Welcome, welcome everyone to TVOSJ, the voice of San Joaquin. It is now time for Balancing the Scales with Vic Bernsdorff.
Welcome to Balancing the Scales, the Economic Justice Report. This is your host, Vic Bernsdorff. And on today's show, we're going to be talking about these topics. Health insurance companies, the S word, as in socialism, benefit corporations, and social benefits in Switzerland. However, before I get to those topics, I want to talk about two issues: private prisons. I'm going to do with state and local news. Private prisons, as you know, are now banned in California, which is great. They were never supposed to be privatized in the first place. Private prisons are all about packing in as many prisoners as possible and keeping them there for as long as possible for profit purposes, not for punishment or rehabilitation or integration into society. Just pure profit. So I'm glad that's done and they're gone. Next item on local news. Stockton has now a universal basic income experiment. It's been going on for a couple months. And this ties into the UBI. It's called the UBI, Universal Basic Income Experiment, that Andrew Yang has been talking about, the presidential contender. Now, I'm going to be having a full show on UBI a couple weeks from now. But I just want to talk about Stockton's right now. This comes from I'm going to quote now from the Stockton's Economic Empowerment Demonstration. And in February, this past year, under 25 randomly selected Stockton families began receiving $500 a month in basic income, cash, with no strings attached. Researchers have tracked most of that free money, how it got spent during the first 5 months of the project. And this is how it breaks down. 40% of the money was spent on food, 25% of the money was spent on home goods and clothing, 11% was on utilities, 10% was spent on gasoline, 30% on other home priorities, other items. Now, let me just talk about this a little bit. The next information comes to you from thebalance.com, dated June 25th, 2019. Talk about universal basic income. Listen to this, folks. This really blows my mind. In 2018, Facebook co-founder Chris Hughes argues that U.S. workers, students, and caregivers making $50,000 or less a year should receive a guaranteed income of $500 a month. Cash is the best thing you can do to improve health outcomes, education outcomes, and lift people out of poverty. To Hughes, it's the only solution to an economy where a small group of people are getting very rich while everyone else is barely getting by. That quote comes from Chris Hughes, the co-founder of Facebook. Hughes said automation and globalization have destroyed the employment market. It's created a lot of part-time contract and temporary jobs, but those jobs are not enough to provide a decent standard of living. Therefore, a universal basic income program is needed. Folks, I never really did a lot of research into Chris Hughes, but you know what? By him making these statements, he has all the makings of a social democrat. And it's amazing how that he himself, probably a billionaire by now, he makes these statements. But okay, so that was the item in the news. I wanted to talk about the Stockton's Basic Income Program. Now, let me move on. As I talked about last week, a lot of my viewers asked, why do you make this show, Vic? I have something I'm going to talk about next week, but I found a YouTube clip with about a woman. Her name is Jovi. Her YouTube, her Facebook website's called Jovi's Home. This is an American woman living in the Netherlands, talking about what they have and what we don't have. And this is the essence of why I created the Balancing the Scales, the Economic Justice Report in the first place. And it's a 10-minute clip. I'm doing 2 minutes per show. So let's watch this 2-minute clip from Jovi, from Jovi's Home. Now, she talks about her life in the Netherlands.
You know, why would I want my daughter to like grow up in a country where, you know, like if she has a baby, like she's not entitled to maternity leave and to be at home like in those super important moments, you know, like that the government is not gonna the federal government is not going to be like serious about it. And like that 6 weeks, like garbage, the unpaid 6 weeks, like please, please don't tell me about that, because 6 weeks, if you've had a C-section, I've had a C-section, 6 weeks is the minimum amount of time that it takes you to heal from a freaking C-section. Do you think that I'm going to be ready to go back into work with like a C-section scar that's barely healed? Like, no. With a teeny tiny baby, your boobs are still like engorged and leaking and like terrible, and you expect that I'm gonna go into work and be like da da da, like be able to? No. And that 6 weeks is unpaid. Why would I want that for my own child when she could grow up in a country like the Netherlands and have a freaking awesome job, and and then be entitled to not only, listen to this, 1 month of maternity, no, sorry, it's called 1 month of pregnancy leave, meaning the last 4 weeks of her pregnancy, she doesn't have to work, and that's paid. So she leaves work when she's like, let's say 8 months pregnant, goes home, she has 4 weeks, hopefully, before she goes into labor, where she can relax, bond with the baby, do the baby room, like all that stuff, like that's what that's foreseen. Get some rest before you enter this like huge new life change. And the Netherlands isn't the only country that does that. I mean, lots of places in Europe do that. They really protect. The United States doesn't do that. You work until you give birth. Like, you literally work until your, like, baby is coming out. And that's when you go on maternity leave. Like, what?
Okay, folks. Hopefully you're starting to understand the purpose of this show. Okay? These folks, Jovi is an American woman living the American dream in the Netherlands. Okay? And I'll be finishing her she has another like 5 or 6 more minutes to go, and I'll do a 2-minute segments next 2 or 3 shows, and we'll finish up Jovi's home. But that you're seeing it yourself from a person, American living in the Netherlands, about their quality of life there. Okay, let me move on now to the 2 economic justice stories in the news. First one I call the third man in the doctor's office. I'm going to be talking about that. We're going to be watching a short clip about Wendell Potter. He was an insurance company insider. And then as part of that topic of insurance companies, I'm going to talk about patient dumping. And you can actually watch a clip of a patient being dumped out of the hospital. But let me now talk about Wendell Potter. We're going to watch a clip about Wendell Potter right now. He is an insurance company executive, worked at Cigna and another health insurance company for about 20 years total. He basically changed sides, and now he's on the Medicare for All side. And he really rails against private health care because it's a money-making machine, as you're going to hear him talk about it. So let's listen to the insider talk about his support for Medicare for All.
Well, as we said, it is complex. So we're going to go inside the healthcare industry now with Wendell Porter, who worked for more than 2 decades with 2 big insurance companies. With a welcome to you, Wendell. As we look at your experience as a former health insurance executive, I'd like your assessment on the proposals to get rid of private coverage. Is that plausible? You think it would increase the quality of health insurance?
I have no doubt that it would. One of the things you need to keep in mind as we were talking about the debates so far, I would argue that we're seeing the candidates divide themselves into 2 camps. Those who are saying that the current system can be fixed, and those who are saying that it just can't. And I'm in the former camp. We've got a system that over the years was built largely by the insurance companies and others who make a lot of money off our healthcare system. They've created this kind of Rube Goldberg type of contraption that is a real money-making machine. And 9 years ago, when the Affordable Care Act was passed, lawmakers decided, well, we just have to keep that Rube Goldberg contraption going because it's just too hard to get rid of it. You're seeing Sanders and Warren saying, no, we've got to get rid of it. And I agree with that because we cannot fix this. We have the most expensive healthcare system in the world, and one that is costing middle-class families and businesses more and more every year.
Okay, I don't want to go through the whole clip, but you heard that, folks. And who was this guy? He was a former, I think, he was a marketing director of Cigna and another company. And you're hearing it. It's a money-making machine. Okay, it's a giant scam. They don't care about your health or your family's health. They care about getting your premiums and making profits for their shareholders. Okay? As a continuation of that, let's watch this clip now of a patient being dumped out of a hospital. Okay? And then I'll come back and talk about the big picture here. Okay? So I got to warn you folks, this is very distressing to watch. Okay?
A hospital in Baltimore is investigating the treatment of one of its patients. Staffers left the woman dressed only in her hospital gown near a bus stop last night in the freezing cold. Jeff Pegues has this story.
So y'all just gonna leave this lady out here with no clothes on?
Overnight, Mamu Baraka was walking past a Baltimore hospital when he noticed something he says he'll never forget.
So I'm assuming that you all are with the security department. Is there a supervisor available?
The hospital's security guards had just wheeled a patient to a bus stop, and in the freezing temperatures, they left her there. The only thing she had on was a hospital gown.
It's about 30 degrees out here right now. Are you okay? Are you unable to speak? Are you okay, ma'am? Do you need me to call the police?
It's called patient dumping, and it doesn't just happen in Baltimore. In 2007, 60 Minutes investigated the practice of removing homeless patients from Los Angeles hospitals and leaving them downtown. Often the patients are not insured or have other financial issues.
Hear about that? Did you just hear that? Either they're uninsured or other financial issues. That's always what it comes down to. You can't pay. They wheel you out on the street in the rain, in the snow. They don't care. You're gone. You're done. You can't pay. It's crazy. By the way, this comes to you. This video comes to you from American Healthcare Horror Stories from truthout.org, dated April 28, 2019. And what I quoted for earlier, the clip from Wendell Potter, came from businessformedicareforall.org, dated 8/5/2019. But let me talk about the bigger picture here, folks. What's really happening here, huh? Let me go back and talk about Wendell Potter. Like I said, he was an insider. He worked on the other side. He worked in the private healthcare system, helping, as a marketing director, helping to fleece the insured premium payers, the customers, right? People who want to be insured. And now he's on the other side. What's interesting about him, he doesn't talk about it in this clip, but he had an epiphany moment where your whole mind, it changes direction. And it happened because he went to a RAM event. RAM is a short for Remote Area Medical, started by Stan Brock. Stan Brock was on Mutual of Omaha's Wild Kingdom back in the 60s, one of the stars. He started this effort to free pop-up healthcare clinics for people who can't afford healthcare, as in at all. It was designed mostly for poor countries, like in South Africa or Southeast Asia. Those countries was not designed for first world countries. But he was saying that a lot of the need is here in America, and we're a first world country. Anyway, so Wendell was watching this in the event. He was in Tennessee at the time. An event happened to be in Tennessee, I believe. He went to the event out of curiosity, and he was appalled. He was really appalled by what he saw. People camping out for days, hundreds of people camping out for days for the 2-day event. I don't know how long it is, but the event has doctors, nurses, practitioners, health practitioners come out and help, or dentists, right? Dentists, eye doctors, they all come out to help these poor people because they can't pay. They donate their time, they donate their materials for free. And he watched these people who were in horrific health conditions. And he kind of said, what am I doing? I'm advocating against these people. So he switched sides, and now he's part of the Medicare for All crowd with Bernie Sanders. So why did I call this segment the third man in the doctor's office? Basically because private health insurance companies get between you and the doctor to pay the least amount possible, not the best treatment for you. They're the ones in the doctor's room between you and the doctor has to call them to say, I want to use this treatment, will you approve it? No, try a cheaper method, and keep negotiating back and forth. And they don't care about your health. They care about not paying. They care about receiving as much income as they can and not paying it out. That's how they make a profit. Okay? That's what goes on in private healthcare companies. Now, it doesn't matter if you have insurance, folks. You can get bills that are called out-of-network bills, right? Some Americans have already committed suicide because of those out-of-network bills. And I talked about that in previous shows. your insurance is not really insurance. It's almost like kind of like you need to buy another insurance to cover what the holes are in your main insurance. It's crazy. And Rebecca Hall, okay, she was the lady you saw walking around in a gown, 30 degrees weather in Baltimore. What happened in that case? The Centers for Medicare and Medicaid Services cited the hospital that dumped her for multiple violations. And according to several reports, the illegal practice of patient dumping is a regular occurrence when patients are uninsured and can't pay for care. And you heard that on that clip, right? It's really insane. Folks, did you ever ask yourself, why does American technology and products keep getting better and cheaper, especially electronics, right? Why can't our healthcare system follow suit? Price, quality and price. Yeah, quality may be improving technologically, but the price keeps going up. It doesn't go the other direction, right? In America, like I said, it's always based on your ability to pay. It's not a human right. It's not a universal right built into our government. All other countries already provide universal health care for all their citizens. Jovi has it in the Netherlands. Why can't we have it? The bigger question, folks, is what affects me personally is I can't figure out why we Americans still put up with getting fleeced, getting dumped out of hospitals, okay, like Miss Rebecca Hall did, and are forced to live in fear of getting sick. Do you really think that the yellow vesters in France or the Hong Kongers, you think they would put up with the system? I saw a picture of Hong Kong protesters fighting for their rights on the street. Folks, you couldn't see the pavement on that street. There were so many Hong Kongers fighting for their rights, protesting. Where are protests? I haven't seen protests here since the Vietnam War or the Occupy movement, okay? And when Bernie Sanders says we need a revolution to change things, we really do, and I haven't seen it yet, okay? And if that's not bad enough, what little benefits we do have, what Obama was able to get us through Obamacare, here it's called Cover California, is a target for elimination by the Republican Party. Okay, let me move on now to the next economic justice story in the news. I want to talk about democratic socialism and creating an America that's great for all of us, and who better to watch a clip from the democratic socialist himself, Bernie Sanders. So let's watch this clip. This is from February 18th, MSNBC 2016. That's when he first ran, but whatever he says now, the things he's saying now, still apply today. So let's watch that clip. And I'll come back and talk about it.
When I talk about democratic socialism, you know what I'm talking about? Social Security. One of the most popular and important programs in this country, developed by FDR to give dignity and security to seniors. And it has been enormously successful in reducing poverty among seniors. When I talk about democratic socialism, I am talking about Medicare, a single-payer healthcare system for the elderly. And in my view, we should expand that concept to all people. I believe that everybody in this country should be entitled to health care as a right, and the most effective way to do it is through a Medicare for all single-payer program. When I talk about democratic socialism, I'm not looking at Venezuela, I'm not looking at Cuba, I'm looking at countries like Denmark and Sweden. And you know what goes on in those countries? All of the kids who have the ability and desire go to college. And you know how much it costs? It is free.
Okay, a lot of benefits in Norway and the Nordic countries. I'm not going to go through that. I've covered a lot of that already in previous shows. Let's talk about the concept of democratic socialism, what Bernie Sanders talks about. Here in America, big public projects are what made America great, folks, okay? As in taxpayer-funded projects. Taxpayer-funded projects, socialized payment system, okay? President Eisenhower had no problem supporting huge socialized infrastructure projects like the interstate system, and that program that a Republican president got the ball rolling for and championed puts a lie to the chant that the U.S. has never been a socialist country. There's proof that it has, okay? After all, we drive on tax-funded paved roads, tax-funded paved bridges, and we all love our socialist police and fire departments. okay, those are all socialized, as in taxpayer funded systems. You wanna have all these things private, folks? I lived in New Jersey. I lived in New York, and I drove to New Jersey every Sunday when I was a kid. Back in the 70s, there was like it was a lot. It was like $10, I think, one way or both ways. It was a lot of money because every 20 miles you had a toll booth. Is that what you want? Is that what you guys want? I don't want it. I like our current system. You can drive for forever. Okay, you got the bridges, yeah, you got tolls, but predominantly California here has no toll roads paid through by taxes, folks. Okay, and I really doubt we want to get rid of our police and fire and have them privatized. Okay. And something else that's interesting, our congressmen and women receive some form of socialist, taxpayer-funded health care. And let me equate that. Socialist here in my show means taxpayer-funded. Okay, I'm talking about a payment system here when I talk about the word socialism. Taxpayer-funded, okay? What's interesting is that, like Mitch McConnell, let's talk about Mitch McConnell. He has to, I think the congressmen and women, they have to go on Obamacare, right? They take a program from Obamacare. But guess what? They get subsidies for their health care plans, right? And as far as I was able to find out with my research, they're subsidized, their health care is subsidized up to 72%. Mitch McConnell made a speech not too long ago about rails against socialism, but he has no problem accepting a tax subsidy from your money, your tax money, and my tax money, right? To pay for his health care. He has no problem with that. That's socialism. And he's talking against socialism. I mean, isn't that hypocritical, folks? Yeah. Let me give you a quote now from Kshama Sawant. I'll tell you who she is after this quote. And I quote her. Trump bragged that America will never be a socialist country. However, a majority of Americans support Medicare for all, Social Security, taxing corporations, subsidizing child care, and providing free college education. Okay? Democratic socialists fight for a different kind of society, one that's based on democracy, equality, and community, as a not me, us. And I think that's Bernie Sanders' new slogan, not me, us. So, having heard that, what is the problem with being called a democratic socialist? You know what I mean? If you have all these things taken care of, you have all the basics in your life taken care of, paid for through taxes, right? You don't have to worry about pension. You don't have to worry about getting old, not having enough money. You don't have to worry about paying for health care. You don't have to worry about the cost of sending your kid to college. You don't have to worry about the cost of child care. Those are taken care of. They're done. Like I said in my last show, it's kind of like a subscription service, okay? You don't pay newsstand price, you save subscription base price, okay? Okay, so that was a second economic story in the news, and now we go on to the spotlight story about benefit corporations, how benefit corporations improve society. Now, we're going to watch a clip, and then I'll come back and talk about it. To be honest with you, I had to do my research a little bit. This is new to me, new concept, as it maybe is to you too. The B in B corporations stand for benefit, as in corporations have to provide a benefit beyond profits for their shareholders. So let's watch this clip, come back and talk about it.
Patagonia, since its beginning in 1973, has been committed to environmental protection. We helped the founders of the B Corp movement develop their certification tool. For a new company, it can be a guide for how to set up a company, not just to deliver value to the shareholders, but for benefit to society and environmental protection.
It's almost like a checklist, for us to say, well, how serious are you about being a socially responsible company? From a business perspective, we cannot prosper unless the whole society prospers.
Success here would be everybody being a B Corp, because every consumer of a product or service on planet Earth knows what a B Corp is and want to only support B Corp companies. Wouldn't that then incentivize the boards of directors of big multinational companies to become B Corps? That's what we want the world to look like.
All companies compete not just to be the best in the world, but the best for the world.
What a concept, huh? Corporations actually benefiting more than just the shareholders. So let me drill down now and talk about that a little bit. Let you know what a B Corp really is. A B Corporation has to act. The purpose of its existence. The B Corporation has to act like a person with a social and environmental conscience, as opposed to a C Corporation, which has pretty much a maximized profit and screw everything and everyone else. Period. Okay? It's not like that. That's not what a B Corporation is. Okay? A benefit corporation, a B Corporation, is a benefit corporation. It's part of a larger movement to make sure that businesses are being used as a force for good in society, to improve society and the environment. Okay? As in, it has to act morally, ethically, and responsible in regards to a number of categories. As in, it's being graded and it's being watched to make sure it adheres to good governance, deals with its employees ethically, how it deals with the local community, how it deals with the environment, and how it deals with its customers. And it's graded on those levels by a certification agency called the B Lab. And the B Lab has been certifying B corporations that believes to be concerned about communities and the environment. It makes sure that if, like in this case, Patagonia, if they say, yeah, we care for the environment, we care for our employees, we care for our community and the environment, in addition to our shareholders. Well, they're going to verify that. They want to see your books, they want to see your programs, they're going to go out in the field and look at your products and everything, and they're going to validate everything you say. That's what a B Lab does, to verify that you're actually providing a benefit not just to the shareholders, but to the customers, your employees, the local community, and the environment. Okay? Kind of think like a B corporation, like the Hippocratic Oath the doctors take to do no harm to the patient, but they go one step further by leaving the world a better place. Okay? So, that's a B corporation. Let me move on now to next show segment called How Great Are We? In this segment, I will be talking about Switzerland and their social benefits. I won't be talking about our benefits. I talked about them many shows ago. Let me just show you what they have, okay? Okay, this is what they have. All employees in Switzerland. By the way, this comes from the website, thelocal.ch, 11/8/2017. So, these are what Swiss employees get. Swiss employees are entitled to 4 weeks vacation a year on top of public holidays. Okay? Unemployed Swiss workers are entitled to 80% of their last salary for 18 months. Women in Switzerland are entitled to 14 weeks paid maternity leave at 80% of salary. The pension system in Switzerland has 3 layers. There's a government pension, there's an occupational pension from your work, and there's a private pension, kind of like a 401k you pay into privately. Daycare for children is government subsidized. Okay? Now, I'm going to talk about 2 individuals who worked and also live in Switzerland and what they say about living there. So first is going to come from a quote from U.S. author Chantal Panazzo. She writes for Vox about her experience in working in Switzerland. And this is what she says, and I quote, "In Switzerland, you don't arrive to a meeting late, but you also don't leave for your lunch break a second past noon. If it's summer, jumping into the lake to swim with the swans is an acceptable way to spend your lunch hour. How about that? If you eat a sandwich at your desk, coworkers and even your boss will scold you." Now, another question was given to a businessman in Switzerland. His name is Jonas Mate. He's a business owner in Switzerland. And this is how he answers the question, is Switzerland a socialist country? And he says, and I quote, "I think Switzerland has the best form of socialism because the people are in charge of the well-being of the people, and their government is limited and charged with ensuring people will stay in charge as long as the people live up to that commitment. It's socialism funded with capitalism." Okay? Now I'm going to read this again, folks, because did you catch the subtlety to how they deal with corruption, or if there's any kind of issue with citizens being fleeced? Let me read it again. "I think Switzerland has the best form of socialism because the people are in charge of the well-being of the people. And their government is limited and charged with ensuring people will stay in charge, but only as long as the people live up to that commitment. It's socialism funded with capitalism. So like I said before, what do you guys care? How you call it? Vic Bernsdorff is a socialist, or he's a social democrat, or he's a capitalist. What do you care? Okay, really, what do you care? If you have your basic needs taken care of, why do you care what you're labeled, right? No one in Switzerland cares. Okay, all their needs are taken care of. Okay, in fact, they're proud to be called a democratic socialist, or democratic socialist policies and programs that provides benefits to their citizens, to everybody. Okay, folks. So as the show is coming to the end, I'm going to be talking about this. Is what I'm going to talk about for next week. I'm going to be talking about the Grayson Bakery. I'm going to get into depth about UBI as in universal basic income. I'm going to be talking about the problems with the gig economy. Talking about Republicans wanting to cut Social Security and Medicare benefits. And also I'll be talking about Canada's social benefits for their citizens. That's the show for today, folks. Thanks for listening. This is Vic Bernsdorff at the Voice of San Joaquin. And always remember, united we feast, divided we starve. Have a great evening. Okay.